So now we're going to move on to beta receptor agonists. Again, remember, agonist means turning on that receptor. So for beta agonists, you're going to have 3 of them. You're going to have beta 1, 2, and 3. So 1, that's going to work specifically on your heart because you only have 1 heart. 2 is going to be on your lungs, and then 3 is going to be on your bladder. In nursing school, we didn't really focus too much on 3, but if your school does, make sure that you do pay attention to what that is. So let's think about beta 1 receptors, right? So beta 1 receptors, or B1, are going to be in your heart. And if you're thinking about that kung fu fighting, because these are adrenergic drugs that are trying to turn that receptor on, you're trying to make that heart pump harder or faster or increase the blood pressure, right? So these medications are going to be used when you're in shock or you're not getting a lot of perfusion in the body and you're trying to make the heart work better because you probably have hypotension. It might be due to hypovolemia. So remember, you're trying to get that body in that fight or flight mode. Think about the different situations where you would need to do that to the human body. Cardiac arrest. So these medications are trying to stimulate the SNS, and think about different scenarios in practice where you would want to use these medications. Beta 2 agonists are actually going to dilate the lungs. So think about situations where you would want the lungs to be open, right? Somebody has asthma. You'll learn in nursing school that albuterol is one of the medications that you're going to give for a rescue situation because you want to dilate those lungs so that the person can get more oxygen. And getting more oxygen is going to lead to better perfusion through the circulatory system. So B3 receptors, adrenergic receptors, so turning that on, what is that going to do to the sphincter in the bladder, right? That's going to control it and tighten it. And these medications, B3 medications, are going to be used for people who have overactive bladders. They have that need, they have to go, so this is going to give them that control so they don't have frequent urgency to have to urinate. An example of that medication is going to be mirabegatron, and if I butchered that, I'm so sorry, but I'll spell it underneath so you guys can see it. And continue following as I keep making more little mini series over these different medications.